Hello. Just waiting for some folks to hop on, of course. So we'll wait till we get up to about 100. Hey, Debbie. Okay, we'll go ahead and get started. I don't have just too much, so hopefully we'll have some questions some time to answer some questions in the comments. So, of course, we are at 34. We have one active case at this time that's been reported to the health center. You're going to see some changes to our website. In the COVID section, it now says just COVID-19. And when you click on that, you'll have an option to click on statistics, which is the data piece. And again, that's being updated Monday through Friday at 4 p.m. On the website and on Facebook. And then you'll also see a tab that says testing. And so on that tab, there's some information about testing and symptoms from the CDC. And then there's also a list of testing sites in the county, most of which are their doctor's offices. And so that encompasses a lot of providers, but it's also got their phone numbers. So that option is there too. And then there'll be a tab to click on for the frequently asked questions and then the guidance that was kind of on that main page. And it's just a way to better organize that information. So you'll see some changes to the website. I want to kind of talk a little bit about numbers and context and just understanding that, yes, 34 cases is, overall since March 22nd when we got our first case. Those are the numbers. But again, keep in mind, as we've talked about on previous lives, there are likely cases out there that have not been tested. And so we need to, assume that it is in the community in some form or in places that or in people that haven't presented for testing yet. So we need to continue to be vigilant and, proactive and make sure that we're doing those recommendations that have been given for infection prevention. And I'll kind of go over those here in just a minute. But again, it's important to know that, that one active case, there are probably more active cases in the community, and we got to be really careful not to be complacent in feeling, like, okay, the virus is gone, we don't need to worry about it anymore, because that's just not the case. And we just need to be cognizant and stay informed. And again, that's not to live in a place of fear or panic. That's just to live in a place of being informed and taking those measures to prevent infection as much as we can, while still, understanding that, our economy is reopening, businesses are reopening, and we are trying to head back to some version of normal life. But again, doing that in a way that is strategic and, informed and just really using those preventative aspects. So we are, tracking testing numbers. We still, it's not mandated for, doctors' offices, hospitals to report negatives. It is mandated for them to report those to the state now. But we do have over 1,300 St. Francis County residents that have been tested that we know of. So that means that testing is ramping up. That's actually, when I looked at numbers just a few minutes ago, it's about 100 more than yesterday than what we had, because it's over 1,300. So that's all pointing in the direction that we're testing more and more people. And when we test more and more people, we're going to identify cases, and we want to identify cases so that we can do our job in isolating and quarantining case contacts. So again, I want to just reiterate that we expect that we are going to see more cases. Again, the virus is not going to just disappear without a vaccine, and that is probably a long way off. And so we expect to see more cases, and that's why we all have to continue being vigilant. I got some questions about where are we at in our other services that we offer. So we're still offering WIC, mainly doing this via phone and mail out vouchers. So if you have questions about that, give us a call and you can talk to the WIC department. Vital records is being done curbside, same thing. Give us a call when you get here, and then we can bring the paperwork out to you and serve you curbside. Nursing, we are doing immunizations, presumptive eligibility application, PPDs and STD services. We ask that you wear a mask when you come to the building. You're going to see our staff wearing a mask when you come to the building. And, you know, we want to really express the importance of immunizations. We know that a lot of people have been at home and are continuing to stay at home, and we just need to make sure to express that it's still really important, especially for children, to get their childhood immunizations. Immunizations are required for kindergarten, 8th grade, and 12th grade for the upcoming school year. And, you know, right now our capacity is good to do that. And so we encourage you to make appointments. We are not doing walk-ins right now. It is by appointment only, and we expect it to probably be by appointment only throughout the summer. So I think back to school is going to look different. If you've ever been here in August, it is a madhouse. The entire building is packed for people needing back to school immunizations. I am really encouraging you to not wait until August. I know we encourage people every year to not do that, but if you can please make an appointment now or throughout the summer as you get a chance to get your kiddos in, you know, that will help you for avoiding wait times and, you know, delays at the start of school. And then we're also doing Ryan White case management, which is HIV case management, and that's being done telephonically as well. If you have questions about that, again, please call us and we'll direct you to our case managers. That's our direct services. There's a lot of services, again, communicable disease surveillance, environmental health, those things are happening too, but I just want to give you an update on our direct services. Just to kind of go back to talking about preventative efforts, hand washing, hand sanitizing, try not to touch your face, masks. We still encourage the use of masks in public settings, especially where social distancing is not easily maintained. When you wear a mask, you protect other people, and when other people wear a mask, they're protecting you. So it's important, especially as we learn more about asymptomatic infections. Even when we may think we're not sick, it's possible that we are. And so it's important that, you know, we continue to encourage the use of those masks as well. And then, of course, social distancing. It's still recommended that when you're out in public with people who are not your household unit, the people you live with, that you maintain 6-foot distance from everyone at all times, or to the best of your ability, okay? So these are, again, those preventative efforts. You can read a lot about this on cdc.gov. And, you know, we know that this is a change of life and is continuing to evolve as we go forward and as new information comes out. But, you know, this will help us prevent infections in the community. There's no way that we are going to be able to prevent all of them, but this will help. And again, keep our most vulnerable safe, including our healthcare workers who are serving people every day. So let me back up and try to get some of these questions that are coming through. Scrolling, I'm trying to see. Do the prison cases count toward the county, or who do those get reported to? So that depends on if it's a person who's been in the prison system locally for an extended period of time, or, you know, Bonne Terre has the routing facility, and so were they diagnosed somewhere else? Did they live in another place for the majority of the year? But by and large, it is our understanding via our conversations with the state that most of those cases will be reported to us and will count for us. At this time, we do not have any of our cases that have been reported from the prisons. We get this information also in a data system that we share with the state. And that does have a marking on it if it is associated with the prison. And so, you know, we will follow up on that, work with the prison system to, you know, isolate and quarantine as appropriate. And we've talked to the state about how those cases are counted. And it sounds like their intention is that they are counted in our county if they are residing in our county for the majority of the year, and if they were diagnosed here. So again, taking into consideration some of the routing facilities, but we haven't ran into that situation exactly quite yet. But that's how that looks to be going. Do you think that it's slowing down at all? It appears that it is. ER data points in this direction as well. Of course, we did not have any new cases last week. This week so far, we've had one. I'm going to add some data to that statistics on the website only, mainly just a trend line that kind of shows you week to week how many cases are being reported. It's just kind of an added layer of data that we're looking at. But it looks like it is. But again, we need to, stay vigilant, understand that the virus is still here. We're still seeing community spread in St. Louis. And as communities open up and people, begin traveling, especially within Missouri or to St. Louis, we're not very far from there, that we probably will, again, continue to see more cases. It hasn't just disappeared. And then, we need to be prepared for the fact that, we might see a surge in the fall. And again, a lot of diseases similar to, I don't like to put flu and COVID-19 in the same bucket because, there are distinct differences, but a lot of diseases, pertussis or whooping cough, flu, and likely COVID-19 is the general consensus that it can be cyclical, and so natural falls or natural rises and falls in disease transmission. But right now, we are seeing a decline at this time, so that's encouraging. But again, continuing to stay vigilant. Gonna scroll through here. Why did businesses just start requiring masks this month instead of earlier in this pandemic? Obviously, businesses don't have to require masks. It is a recommendation, not a mandate. But as you recall, last month, the CDC changed its guidance or updated its guidance to recommend the use of masks in public settings. And so that was a change from what was being recommended earlier on in early March because data was becoming more available. And so there is that change in that guidance. But again, it's not mandatory that businesses require folks to wear masks, but it is recommended in the public setting. Is it true that CDC is saying you can't get the virus from touching? So I looked at some updated CDC guidance earlier. It doesn't remove that verbiage entirely. What it says is that the primary way that COVID-19 or SARS-CoV-2, the virus that causes the disease COVID-19, the primary way that is spread is through respiratory droplets in the air. And so in close proximity where you're able to breathe those in, or it enters in through your eyes or your mouth, your nose, that type of thing. That's the primary way. But then, I just looked at this guidance earlier because I figured this was going to be a question that was asked. It still goes on to say that it is thought that this can also be spread by touching surfaces that have been infected with this virus or where that's landed from those respiratory droplets. So, their disinfection recommendations have not changed, and that's up on their website. So I know that, again, that's maybe to a lesser degree, but the primary way is through respiratory droplets. I see people asking about the data. You can look at that data from yesterday and the days before. Just looking at my time, I'm going to have to hop off here in just a second. Another question that I just answered, sorry. Some of these, if you'll go back and watch kind of the earlier video, I'm just trying to get through some of these ones that I've already kind of answered about testing. And I'll post today, we will post for our numbers today, how many exactly that we know of that have been tested. And then again, you can see our positive cases in the data every day, and you can see that broke down now by viral testing, serology, which serology is not recommended to be used as a diagnostic tool, and then by epi investigation. I'm just trying to scroll through here to try to get some of these. It looks like I think I've just about got them all. So We appreciate you being on. Again, the audience is dwindling week to week. And so, I'll continue doing these for as long as they seem beneficial. But there's lots of information on cdc.gov, a vast amount of information for guidance for businesses and various sectors. Also lots of information on prevention and symptoms. And again, we've changed our website around just slightly to give some information about where you might be able to be tested. We, of course, recommend that you call those testing sites or your healthcare provider before going in to be tested if you think you're sick. And again, lots of information on our website and sharing through Facebook every day. So we appreciate you being on. I will see you next Thursday at 2 p.m. We will not have cases updated on Monday because we are closed for Memorial Day. But again, we're continuing to do that typically Monday through Friday on our normal business days at 4 p.m. and or unless something happens that is concerning that we need to get out to you. So we appreciate you. Thank you.